Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752 right here in the studio. You can speak directly with Dr. Darrow. You can find him at his website as well, which is www.lastemcells.com. That's lastemcells.com, and see him performing the treatments on videos, as well as being able to email him off of every page on the site. Did you want to add something to that before we go to...
I do. Well, Ginger, you hang there. I know you have a wrist problem, and I had one too, so we're going to be friends. First of all, I want as many callers as I can get because it makes it a lot of fun for us instead of us just blabbing. I like to talk to people. Nita and I do have a good time, though, without callers, but we like it better with callers, don't we, Nita?
Yes, it's fresh and new and interesting.
Right, and I like to get stumped by things I don't know because I can go look up anything and help people out. So the number to the studio right now to talk to us is 866-870-5752. 866-870-5752. Let's get some lively conversation going. And to watch me doing the procedures of regenerative medicine for orthopedic issues, instead of having surgery, just look at www.lastemcells.com. And every page there, beside having videos of me doing the procedures, has a spot to email me. I answer emails all day, all night. I stay up till midnight usually answering emails. And by the way, everybody gets my cell number and my email address who comes into the office. I like to stay close contact with my patients. And one last thing here, the office number, if you don't get the information you need listening, is 800-300-9300, 800-300-9300. We have people by the phones right now if you want to call in to the office or at the studio. Talk to me, 866-870-5752. Stump me, ask me something I don't know. I love it. Anyway, Ginger, how long ago did you hurt your wrist?
Hello.
Hello, Ginger. Talk up. Scream at us.
I had a surgery for carpal tunnel syndrome about 6 weeks ago.
Okay.
I have in both hands. They determined that one was severe, one was moderate.
Yeah.
I hesitated for a year before I did it, but the symptoms were just getting worse and worse.
Sure.
I couldn't sleep at night.
Oh, it's terrible.
I had burning, terrible pain.
Sure.
And so I finally went in, and I was going to get a cortisone shot, but kind of talked, I don't know, somebody talked me into doing the surgery. I guess the surgeon did. So I've been having a hard time of it.
Okay. What's the hard time that you're having?
Well, there's pain. They did the open release.
Yes.
Instead of the orthoscopic.
Yes.
So I have a lot of pain in the area of the incision.
Okay.
It's still painful. It's a lot better than it was.
Okay, good.
And the doctor keeps telling me, be patient. It'll get better, but nerve damage takes a long time to heal, and it may not be 100%.
Okay, so let me ask you this.
I'm looking for advice.
Okay, hang on, Ginger. Number one, after surgery, it usually does hurt. You know, that's normal. And 6 weeks, it's not that normal. It's possible, though. And what I want to know is the pain at the incision site, or is it the same pain you were having before, the nerve pain? Or both?
It's mainly the incision site, the healing, I guess. And I've got scar tissue, and I started PT, and she's giving me exercises to break down the scar tissue.
Okay.
I get that part.
Okay, very good. So has all the tingling, numbness, pain, what we call paresthesias, did the surgery get rid of that?
No, the right hand, which is what I had done, it's still, it's not normal.
Okay.
And I'd say it's certainly a lot better. I'm not getting that burning anymore.
That's good. That's good.
But I am still having, it's as though I have silk gloves on. And underneath my fingernails, I still have numbness. And, you know, they keep telling me, be patient, that it'll gradually get better.
Well, I'm going to tell you the same thing. I'm going to say be patient, because 6 weeks after a surgery is not that long. and there's still a lot of inflammation. When there's surgery, there's bleeding, and the red cells in the blood cause inflammation. That's part of the healing process. So you've had pretty good success, not what I would have hoped or not what you would have hoped, but that's life. You know, some surgeries come out amazing and some don't come out as good, but it's too early at 6 weeks to know. We would like at 6 weeks for you to be all better, but this may take you several months before it quiets down, depending on, you know, the inflammation in your body and, you know, what kind of a healer you are. Okay?
Well,
now, what I would tell you...
I'm thinking about getting a cortisone shot in the left hand because it's bothering me a lot, and I don't want to have surgery on it. What do you think about that?
You don't need to use cortisone. If you go to a doctor that uses ultrasound to look inside, you can do what's called a hydrodissection. I like that better than steroids. But most doctors use steroids. So you only had one hand operated on?
Oh, yes, just the right hand. And we were going to do the left hand, but no way am I going to do that left hand at this point now.
Okay. Well, you went to the invasive approach before the conservative approach.
That's true.
And
I should have not done that, but I did.
Yeah. And, you know, see, the first law of medicine is do no harm.
Yeah.
You know, which means be conservative. You know, don't hurt anybody, but be conservative first. And there are injections. And if you want to email me through the website, which is www.lastemcells.com, can you write that down?
Well, I don't have a pencil handy, but I can call the office, right?
You can call the office, yeah. 800-300-9300. But if you go to the website, 800-300, it's easy. 800-300-9300. But if you can email me today from the website, it's so easy. lastemcells.com.
Okay.
And you go, lastemcells.com. Just go there, and there's a spot on every page to email me.
Okay.
If you email me, I will call you back and give you more direct information about how to do this without steroids, because...
Well, I go to Kaiser. Do you think they'd have that available?
No, you're not going to be able to do it at Kaiser. You know, here's the good news about Kaiser. You know, if you're really sick and you need to be in a hospital or you're going to die, it's a great place to go. But for good health things, that's not what they do. They don't do any, you know, I don't want to call it alternative medicine because it's not alternative, but adjunctive medicine, a lot of words for it. You can't go to Kaiser to get it. They're not allowed to do it. So the good news is you pay less to go to Kaiser than having regular health insurance, but they're not going to do a lot of things. So you save up your money that you're not paying for regular insurance or other things that aren't covered by insurance. And that's what you use for doctors like me in most cases who can do these things, okay? So we'll talk, okay? You just email me and put your phone number on there, and I'll give you a call. And we'll get you settled so you don't have to have surgery on your other hand, hopefully.
Okay, well, thank you.
But, you know, the good news is there's a very high probability that the hand you had surgery on that you're still having pain will resolve.
Good. Well, nice to hear another opinion because everybody seems to say that. It's very hard to be patient, but I know I have to be.
Well, you have to be no matter what. What are you going to do? It is what it is.
I was thinking, I'm doing all sorts of, you know, homeopathic stuff. I'm putting, you know, on the area to help with everything. I'm doing what I can. You know, I think it helps a little.
Okay, you can talk to your doctor about doing like warm and hot soaks. They
already have. You know,
they're doing the PT people are doing all that stuff.
Okay, and I, you know, believe me, doctor. The first week was horrible.
Oh, I'm so sorry. No, it's awful.
I mean, it was really bad.
You know, another thing you can think about is go buy some digestive.
Better, so I'm, you know, I've got to have hope.
All right, Ginger, go buy some digestive enzymes, and take a big dose between each meal, and that will help get rid of that scar tissue hopefully.
Oh, digestive enzymes?
Yes, but you don't take them with food because it'll digest the food. You take them in between meals, and you got to get a big dose. If it hurts your tummy, stop doing it, and that'll help the healing with that.
Okay,
Also, I would suggest you go to a chiropractor who has a very powerful laser. And there's a guy near me across the street named Mike Sheps, S-H-E-P-S. I don't have his number right here, who has probably the most powerful lasers on the planet that help things like that heal. And it may actually be able to heal the other carpal tunnel that's still there. So write that down, Mike Sheps, S-H-E-P-S. He's a chiropractor in West Hill. S-H-E-P-S.
Okay.
Great guy, powerful laser that gets rid of inflammation. And you may not even have to have that second surgery. But anyway, email me through the website, www.lastemcells.com. I'll give you tons of information. We'll talk and get you healed up, hopefully. Okay? God bless you.
Thank you.
Thank you, Ginger. So we have time left. Do you want to give the phone number?
Why not? I want to give out free books. We'll mail them for you for free. Not even charge you postage for my book on stem cell and platelet therapy. Regenerate, don't operate. Call me now. You'll get the book. And the phone number to call the studio right now to get the book, or you can call the office also, is 866-870-5752. You'll catch me live. You can ask your questions about your friends, family, whatever, for musculoskeletal complaints, orthopedic issues where you don't want to have surgery. Or just call the office at 800-300-9300. I'm going to go to a question. Well,
okay.
You know what? First, I'm going to do a joke.
I was hoping you forgot.
Because I like to hear you laugh. When people don't call, Nita gets punished.
Well, let's give the phone number again before the joke.
It's 866-870-5752. Call in and save Nita. All right, Nita, you ready?
Yes, ready as I'll ever be. Oh, look, I think a call is coming in.
Well, it's not there quite yet.
Well, let's talk about the book for a second, because I don't think people realize that stem cell and platelet therapy, Regenerate, Don't Operate, the book you're going to get by calling in the show right now for free, totally free, not even any postage. It has 264 scientific studies, so it can't be called a scientific study if it isn't really one. So that means they really are scientific studies.
It's real science. But Nita, you can't distract me.
Oh, look, it's Harry from Claremont. Oh, look at that.
Oh, Nita, you're so tricky. Harry, how are you? This is Dr. Marc Darrow. Your hip bothers you. How long has it been going on for?
The pain has been going on terrifically for a month, but the hip pain started 6 months ago. I'm scheduled for surgery. The hip pain is so bad.
Okay. And did the doctor tell you of arthritis?
Osteoarthritis, yes.
Okay. And did he tell you how long that arthritis was there for?
No, he didn't, no.
Did you have any pain before 6 months ago?
Actually, I did not.
Okay, so guess what? Guess what, Harry? Harry, listen. Guess what? You've had arthritis more than 6 months. You've had it for years. So why operate on it now because you have pain? Are you getting what I'm trying to say or not?
I have a question for you.
But wait, did you understand what I said?
Yeah, I understand part of what you said. I didn't.
Okay, here's the deal.
6 months.
That arthritis has been there for years.
I agree with you.
But it didn't cause pain. Now you have pain in your hip and you're getting a hip replacement for the same arthritis that didn't cause you pain.
What do you suggest?
I suggest that you have someone like myself look at you and see if platelets, PRP from your own blood or stem cells can heal you to get you back.
Can I ask you a question?
As many as you like.
Okay, so this is a question and answer show. I am at the point where I can barely walk across the kitchen without pain.
Okay.
So in your procedure,
yes.
Can your procedure effectively help me within? I know you have to examine me. You don't need to tell me that. I'm at the position where I cannot walk across the kitchen floor. So I should go in and cancel my surgery with the hopes that you can correct this.
I'm not telling you what to do. I just give you information. You decide.
I know you're not telling me what to do. Don't tell me that. I know that.
I'm not going to tell you what to do, Harry. I haven't even met you. You're not my patient.
I'm telling you, I can't walk across the kitchen.
I know, but guess what, Harry? There's people that can't walk across the kitchen and have hip pain but don't have arthritis.
What's that have to do related to my pain? Are you telling, what can you do for me, what I'm asking you?
I don't know. I haven't examined you.
Oh, I know you have to. So my surgery is scheduled in 10 days.
Well, then you should do what you want to do. I can't tell you what to do.
I know you can't tell me what to do.
I can tell you that you can always...
I'm asking you a question.
I know.
The pain is so severe. Can your procedure help me in this
I don't know.
area of pain? How is it
I
going
don't
to grow
know.
cartilage in a short period of time? I'm asking you a question.
Are you mad at me, Harry?
You don't answer questions. You only give your side of the story. I'm asking you a legitimate question. I'm 76 years old. I've been around a little while.
Okay.
So I'm going to take this. We don't really like rude callers. And I can't be pushed into telling someone because they're yelling at me.
Well, in medicine, you can't make promises.
Well, I can't make promises, but I can't do anything until I examine someone to take their history. The point of this, though, is very simple. And unfortunately, Harry didn't get it because he was mad. The point is there are people without arthritis who have hip pain who can't walk across the room, who can't take one step. So to get a surgery for arthritis that just started, which has been there for years and didn't cause any problems, makes no sense to me. But that's just me. I'm not that guy's doctor. He's got to listen to his doctors.
Well, he has free will, and he could, within the next 10 days, I'm just talking theoretically here, get a consultation with you.
Well, he
because
could,
it's very common in medicine to get a second opinion.
I'm not so sure I want some guy coming in the office yelling at me. I'm going to tell you a funny story, okay?
Okay, Harry, don't yell at Mark when you go to see for the consultation.
So I have a brother. I have a brother, David, who's 11 years older than I am. He's 85, okay? And my whole life, he said, "Wait till you get to be my age, Marky." And I'd go, "Davey, I'm never going to be your age. It can't happen." And he goes, "Wait till you be my age. You'll see how tough things are." And that's what I got from Harry. Harry's yelling at me. I'm 76. Well, so what? I'm 74. Big deal. Doesn't matter age. Age means nothing anymore. I have patients come in who are in their 90s who are doing sports like crazy. Things have changed, Harry. You know, being old doesn't make you grumpy unless you want to be grumpy. I'm sorry to be telling you that. I love you anyway, Harry. I don't care if you're grumpy or not, but I'm not going to tell you what to do. I don't tell patients what to do when they come in. I educate them, and they always say, "What should I do?" I go, "I'm not going to tell you. I'll give you all the information you need, and I'll spend as much time as you need, and I'm going to give you my cell number, and I'm going to give you my email address so you can contact me anytime you want to, okay?" That's what I do for all my patients. And I say, you decide. I don't make decisions for people. I have enough trouble making decisions for myself. I do.
Life is very complicated. You know what Betty Davis said, the famous actress from decades ago? Getting old ain't for sissies.
Yeah, I know.
Getting older ain't for sissies. That's a famous quote of hers.
That's right. And was it UB Banks who said, "If I'd have known better, I would have taken better care of myself"?
I think it was. But if anybody wants to correct our quotations, they're welcome to call us right now at 866-870-5752. And if you happen to have some pain and want to talk to Dr. Darrow about it, that's the bonus. But we really like to stay very positively focused here, and we like to find solutions. But there's no guarantees in medicine, just like there's no guarantees in life.
That's the story. And, you know, the reason I don't tell people what to do, Nita, is because I don't have answers for everybody. There are some people that need to have a surgery because they think they need to. Do you remember that Warren, what was the guy's name? Schwarzkopf. Do you remember Schwarzkopf, the general?
Yes.
So he had a prostate removal, and he was up on a big billboard. I was driving by, and it was a picture of him saying, I had prostate surgery, and I'm so glad I did that. But there's a lot of people that don't want a prostate surgery, and they do other things to heal, right?
Right.
There's a lot there. How many billion people on the planet? 8 billion? There's 8 billion ways to do things, and you get the choice to do it the way you want.
Well, every person's body is different also, right?
Yeah, every person's body is different. You have to decide. I don't hold any keys to anything other than I know the work I do is amazing work.
Okay, let's talk to Greg.
Greg, thank God you're saving us. So, Greg, you live in Alhambra and you have a shoulder. What's going on with that shoulder?
Well, let's see. I'm driving, so let me pull over and park here.
Smart man.
I was doing something a few years ago where I was trying to pull two heavy objects towards each other. So I had one in one hand, one in the other, and I was pulling them, laterally towards each other.
Sure.
And I heard something rip in my right shoulder.
Okay.
That reminded me of when you tear a chicken leg off of a chicken carcass.
Sure.
It had all that cartilage ripping
Ouch.
kind of sound and all that.
Yep.
Now, it wasn't particularly painful, but it disabled me at that point.
Sure.
And I had to sit down, and then my arm was pretty much disabled for, a week or so after that.
Okay.
But I was never really any sharp pain. Anyways, later on I had an MRI, and because everybody thought it was a rotator cuff or torn something or another, and they said that that from the MRI there was no signs of any tearing or anything.
Okay.
So what they did is they gave me this meloxicam. I think
that's an anti-inflammatory, non-steroidal anti-inflammatory.
Right, and now I'm on that. It feels like I'm going to be on that for the rest of my life. I mean,
No, you're not. Well, that's a choice every day.
Several years now.
Yeah, but that's your choice. Who's telling you have to do that?
I didn't want to get mad at you. But that's what I'm telling you.
Good call.
An alternative. Can I talk to you about getting some kind of therapy to restore that?
Absolutely. First of all, let me tell you something. I don't think much happened to your shoulder when you heard the chicken bone break or whatever. I think that was probably a ligament that just snapped over the bone, and that's very common. It happens to me all the time. There was a move in gymnastics that I used to do when I was young, and it was where you go. I was on a high bar, and you put your feet between your hands, and then you shoot up, and you would call it a dislocation. It really wasn't. The shoulders would snap. And nothing was wrong with my shoulders. I kept working out. And that's, I think, what happened to you. Now, this is interesting. The fact that they did an MRI and didn't show any issues, if it had shown a tear, you would have gotten a surgery that wouldn't have worked. Because there was nothing wrong with your shoulder to begin with. So I'm not going to tell you what to do. You're not my patient. If it was me, I would not be taking an anti-inflammatory every day. The studies show that they cause osteoarthritis. And they can also cause stomach bleeds. I've had people in the ICU pumping them with blood all night long because they almost died from ulcers from taking anti-inflammatories. Anyway, God bless you, man. Thank you much, Greg. And you can go to my website at www.lastemcells.com, or you can call the office at 800-300-9300. Thank you, Nita Valens. You're an amazing host. Thank you, Suzette and Alex and everybody else on the crew. We love you all, and thank you, callers.
And we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, To take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.